It's a wonderful opportunity to talk to some future pioneers. So I brought a reasonably challenging topic. We are struggling with it for last 3 years, and it is a small development for a very high impact question. The question is that MRI generates a lot of heating. With high field, the heating is not going to be less. So that RF heating is going to be a problem. A small target project here is, what do you do when patients have implanted devices in the sensitive tissues like the brain? It will be more local heating beyond any imagination. Measurements can say that if you apply routine techniques, it will be 5 to 30 degrees centigrade temperature rise. So we have developed techniques that can be done almost anywhere in the world to some extent, and one can lower the heating potential. So in this particular project, we image about 25 to 30 patients every year, more or less in the research setting, and image them at 10 times to 100 times lower RF power. And so at the top, we are talking about DBS and VNS electrodes, typically useful for Parkinson and seizure and depression and whatnot. Those patients don't get good MRIs. They get very dangerous MRI sometimes, or no MRI at all, and they don't get anything beyond their brain. So if there is a spinal fracture in the C-spine causing patient to die, we also cannot image that patient. We can only image at the brain. But if the RF power is 10 to 100 times low, then probably some vendors will be excited about it and develop some spine imaging techniques. Here is the DBS on the left and right side. On the left is on your left is the T2 image. You can see the small dark hole, but rest of the brain you can see some lesion, potential cancers, and also other interesting things on the FLAIR image on the right. T2 and FLAIR, these are done at a 3D technique at about 20 times lower SAR. Here is a double IR technique, and some people are familiar with it. Double IR on the left is a industrial standard of about normal SAR, and on the right you have a low SAR technique, 10 times lower SAR or about 8 times lower SAR. The quality is not too bad, and we are going to publish something on that quality comparison. Here are some spine techniques developed at an early stage about 2 years ago in GE and Siemens. T1 imaging, which is absolutely necessary for tumor, is almost impossible to do at a low SAR. T1 is very high SAR or power generation technique, but these are done at 0.1 watt, which is about 20 times lower SAR. So next generation vendors may take some of these developments in their mind and notice that low SAR, 10 to 20 or 50 times lower power, is not necessarily a lower quality. Dr. David Hackney, Dr. Dave Alsop, they have been instrumental in helping the group advance, and I am looking forward for more thoughts from Boston community and abroad. Thank you.